development. These are relatively new, and so the results may be a little bit harder to interpret just because this science is actually still very much developing, and it's certainly not a replacement for traditional toxicology testing. So it doesn't necessarily tell you with the level of specificity that a toxicology study would tell you. Okay, so now we're going to get into the study options identified by the working group for spending the $1 million health study budget. So option 1 is what we call a clinical assessment survey of highly affected individuals. Okay. So the general description would be conducting a clinical assessment of about 100 people. What do we mean by clinical assessment survey? Well, this could include, for example, a questionnaire about health conditions that person is experiencing or has experienced. It could include, for example, a clinical evaluation or some kind of clinical testing. Specifically, what it would include really depends on what kind of group of conditions we would want to look at, and that is still an open question that we do want to discuss and get your input tonight. Obviously, part of this study would be an analysis of the data, and the proposal here, the draft scope, was again to focus on people who've experienced some of the more serious health symptoms from this incident. It may possibly include some environmental sampling, so at the participants' homes, because we do understand that I know there was a lot of concern about indoor residue, indoor exposures. And so, we're certainly open to that possibility of that kind of sampling. Okay. What information can this provide? Well, it's like a systematic way to collect this kind of data on health symptoms that people have experienced or are experiencing. And it will provide that data on what's being experienced by some of the kind of most affected people in the community. This kind of study could look at possible patterns in the health effects and also some of these environmental exposures in this group. Okay. Some strengths and limitations of this particular option. Well, we can collect really detailed information about health symptoms using a standardized, very scientifically rigorous method. We can really focus on the health symptoms that people are experiencing, right? So this is not hypothetical. This is, very much what people have experienced or are experiencing. Focuses on a select group of highly affected people. So it's really trying to hone in on folks who feel like they have been very seriously affected. Another benefit of this kind of a clinical assessment survey is that you can capture information on a large range of health effects. You can ask about many different kinds of symptoms. And it provides data on specific health conditions in this community, which is really important. Okay. Some limitations, I mentioned about 100 people, so this is a limited number, although 100 is actually a pretty decent number to provide really detailed information. May be hard. It depends on a number of considerations here, but it may be hard to say if the community has been more affected compared to others. This, again, it depends on how specific we can get with this group, and that's one of the discussion questions that I have. I'll show you later in the presentation. But basically, the more specific you can get, the more ability you have to actually compare to other populations. For a question, if it includes a questionnaire, it may be more difficult for people to remember details about past health problems. Although with health problems that people are currently experiencing, that does make it a little bit easier for people to report those symptoms or issues. And again, whether the exposures cause the health symptoms in a specific person, the science is really just not available to really say with that definity to be able to establish that cause. Okay. The second option is we call data integration and exposure modeling. And data integration, what that means is basically putting some existing data together. So we know that we have a lot of data from both health data and also environmental data. So environmental data from all the air sampling, the soil sampling, the indoor air sampling, indoor wipe sampling that were collected collected by the various agencies over the course of a couple of years. We also know that there is health data that's existing, so that includes the health complaints that were reported to the LA County Public Health Department, as well as the CASPER study that was conducted by the LA County Public Health Department that conducted a survey of community members about their health symptoms. Okay. So what would be next after compiling all this data and putting it together? You can conduct what's called exposure modeling. And that can include both outdoor exposures as well as indoor exposures. And what the output of this is essentially like an exposure map. So, if you look at a map and say, okay, for this particular chemical, it was I would estimate this level here and this level in that area, and so on. Maybe a different map for different types of chemicals. Okay. I also made a note that another area of concern for the community may have been the diesel trucks that were used while they were trying to kill well. The exposures related to that. I hear a lot of no. That's possible. If it's not an issue.
Tell them in Granada Hills and Chatsworth.
Okay. So what can this do? So this kind of study can identify potential patterns in both the exposures and also the health symptoms. And for this particular option, we would estimate about $500,000. So if this option is selected, then there is another $500,000 to spend on additional efforts. Okay. Strengths and limitations makes use of existing data to estimate what this community was exposed to in different areas. It can be used to calculate health risks across the main affected areas, for example, using the exposure map, but noting that unfortunately health risk calculations can really only evaluate the risks for pollutants where you have established risk assessment health values, which does not include the mercaptan odorants. Okay, so at this point, what I'm going to do is I'm going to get a sense for what folks prefer at this stage. So our original plan was to have discussion in breakout groups, and essentially everyone gets to discuss every one of these questions. So you're not limited to any one particular question at any one particular table. And our thought was that this would allow folks to weigh in on every question and also discuss amongst your group. And in addition to that, you're not just discussing in the group. After the breakout sessions, we're going to have a report back, so everyone also gets to hear your thoughts and ideas. The other option is, I understand that people have different preferences, so the other option is to go with more a traditional format, which is, basically folks would fill in a blue card and we would go one by one. Given the number of people that I see in this room, I'm thinking we're probably going to have to have some kind of time limit if we go with that kind of format. But I will leave it up to the desire of this group. So I'm going to just ask for a show of hands who prefers to go one by one.
Which one is that? Is that where we can go up individually or in the breakout section?
That's one by one individually.
Okay.
Big group.
Big group. Okay.
One large group, folks.
Yeah.
One large group. Everybody hears everything.
Yeah. Everyone hears everything.
Community support.
Transparency.
Transparency.
Bring this up as a group.
So I would also mention that the breakout groups, I hear some concerns about transparency. The breakout groups, where we would be recording everything on these easels and trying to put them up wherever we can. I know we got Christmas decorations and such, but we would try to have that, and we would have one of the folks from the community be doing the reporting back to the larger group. Okay. All right. So one more time, show of hands for one by one. I'm going to have Leo do a count.
You're going to count? I don't
think
think
it's
you need to count.
Kind of obvious.
Looks like
Another read.
looks like it's pretty much that.
Pretty obvious.
I can
Jazz
tell you
hands.
it's the majority.
Bust us up.
You already decided we're wasting time.
Yeah.
The records show 90% of the people have their hands up.
You can't have two hands. It's the rule.
Bring my legs up.
We we'd have to do a study about that.
All I have to do is ask one question, that's it. Good, you're included.
I'm
sure it's a good one.
We're starting with the staff.
The question.
Breakout groups, see a show of hands.
Good job.
Way to go, folks, that's the right thing to do.
Okay. So for folks who want to speak, we've got blue cards. So go ahead and fill them out so we can do this in an organized fashion.
Someone else asked, ask something else. Hell, I am confrontational.
Remember what he said, right?
We're not using them.
Yeah, not using them as things. You just gotta ask questions.
All right, so as we're passing out cards, and I have a staff here already, I'm just going to introduce myself. My name is Philip Klein. I'm the Deputy Executive Officer at the South Coast AQMD. And so, again, it's fine. We've already gotten good feedback from you guys. That's what this meeting is about, is getting feedback. You know, this $1 million study, whatever it can do, is going to go forward one way or the other. We're really looking for you to give us ideas. We put our ideas up on the screen. We're looking for feedback, but we really, we want to do something that's useful for the community. We understand that it is not the complete health study that everyone is looking for, but this is what we have to work with. We don't have any control to go back on what the settlement was, but we've not just sat with the 1 million. We're trying to leverage in-kind contributions from other agencies. We're trying to find any other way we can contribute. And so we do think there is some value in what's been proposed. So we're really looking at what we can do going forward and looking for your feedback on what would be useful for you. So we'll go through the cards, fill out a card, bring it up here. Joe Kay and I will sit up here and try to address your questions. But I'm just encouraging you to give us, constructive feedback on what we're proposing. And, going back in time to figure out why the settlement was done the way it was, we have no control over that. That's all a legal process. We can't go backwards in time and change what's been done. So we'll continue to work to get as many resources as possible, to get as complete a study as we possibly can, understanding we're not going to be able to do everything. So, is everyone filling out their cards? So we'll go ahead and get started. I know we're sitting down at this small table.